Good evening, friends. Dr. Vishwanath here. Advance wishes for a wonderful year. This year, as we are gone through a lot of pain worldwide. Pray to God that all this clears the coming year. Best wishes, God's grace. And I thought that my basic aim is to educate patients or patients in especially chronic diseases like diabetes, hypertension, hypothyroidism, hyperthyroidism, other chronic diseases, including probably cancer later on, which I don't have much experience with, and whatever. These are the, especially diabetes, hypertension, high cholesterol, all these, including genetic factors, then obesity, smoking, sloth, and excessive drinking. All these are contribute to a majority of the risk factors like diabetes, hypertension, which in turn is the cause for sudden deaths or uh, patients being incapacitated by a stroke or a hemorrhage and things like that, or a kidney failure, or a peripheral vascular disease, blood flow to the leg, amputation of the leg. So, uh, the very important thing which patients have to realize is that they have got a right when they go to the doctor to ask their doubts. What my father used to do, I remember, is he used to write down questions when sitting, waiting for a doctor, all these. Go inside and tell doctor, this is one, this I've got, these are my doubts, clear everything. And then once he is convinced only, he would go out. So I feel that that is the patient's right, and it's the responsibility of the doctor to explain. So, because sometimes we write some tests, like yesterday it happened, I'll not naming anything, a particular test which was related to cancer, which was a general screening was written. And this patient was so scared that she had cancer. It was a screening test, like you do for a cervical smear, pap smear to screen for cervical cancer, or for the prostate enlargement in elderly people, yearly once, prostate specific antigen. We tell them, don't worry, this test is to screen for cancer. If the values are getting higher every year we do the screening, then we opt for surgical removal rather than medical treatment. So this is something which is very important, our doctor-patient relationship. I would, I always feel that the patient comes first. The patient is the one because of whom we live. My food and my family is taken care because of the patients. And my ambition as a doctor, my interest, my passion, etc., are all centered on my patients. So this year I dedicate to my patients, to my parents, my family, everyone. And this with good faith, not to blame anyone, no one is perfect. I also correct myself. I am teaching now students, I am learning from that. So the most important thing is when the patient comes in, a doctor knows whether a doctor has to be a psychologist, whether they are tense, worried, anxious. Such patients, you calm them down. This is the art of medicine, not to frighten them. There are some patients who are careless, not bothered. Sugar 400, what will happen? BP 1. These people you have got to frighten. I have personally taken one of the patients who was feeling like this and shown him a patient in coma with stroke because of high BP, sudden rupture, and then explain this is the reason why you have got to take it seriously. Hypertension, silent killer, tube bursts, pump fails, heart attack, heart failure. Tube burst is hemorrhage, pump is the heart, fails, filter leaks. These are the major complications of hypertension. So sometimes this has got to be explained. For some patients, it has to be explained subtly. And when you're talking about the disease, a chronic disease, the disease has got to be told like diabetes is a vascular problem, vessels are getting occluded, blood vessels supply the entire body. So any part can be affected in diabetes. Diabetes is not just about controlling the sugar, it has got various components. It is a syndrome actually, because there is high cholesterol associated with most diabetes, what we call dyslipidemia. About 25-30% of the patients, especially obese, have got hypothyroidism. Hypertension is most often prevalent in the diabetes and vascular problems. So they have to, the reason for treating diabetes and hypertension is to prevent complications to various other organs. That is to the brain, eyes, heart, kidneys, peripheral nerves, and the peripheral vessels, especially, very importantly. So, once this is explained, the patient will realize why we are telling a master checkup. Because we'd like to know how these organs are once in a while. If sugar is being treated, treating the sugar doesn't mean that the sugar totally, the disease is gone. The disease is only controlled. By treating, you are prolonging the complications and hopefully finding other thing, because every diabetic, when we add a statin, we tell that it is not just to lower the cholesterol and triglycerides, it is to prevent further blockage in the vessels later on, which happens in diabetics because in diabetics the wall of the vessels inside, it has the capacity to draw the circulating macrophages, fibrinogen, whatever, all these, and form clots gradually, narrowing the vessels. This process is delayed or prolonged by drugs called statins. Sometimes I've seen patients come back after 6 months telling that, sir, I went to another doctor, he said cholesterol is fine, they have stopped. So once you explain this, this is not only for controlling cholesterol triglycerides, but on the long term for this, it becomes very important. And other things are like metformin given for diabetes. It intrudes with the absorption of certain vitamins, B6, B12. So what happens is they develop deficiency of vitamins. And the patient says, sir, well, high sugar also we had pain, numbness in the leg. Now also it is present. Sugar is normal. That is because the deficiency persists because of the drug.